What's going on, everybody? My name is Dr. Nathan Thompson with Exemplify Health Center, your Wellness Way affiliate in Yorkville, Illinois. Happy Saturday, guys. Hope you guys are enjoying your weekend. Next weekend is 4th of July. It's coming up quickly. Hope you guys have been enjoying your summer. If you're popping on right now, just go ahead and say hello. Give me a wave. Let me know where you're watching from. I always love to see people from all over the United States that watch these videos, and it makes me happy. I love doing that. I love teaching you guys about how to improve your lives, how to better your lives from a lot different perspective. Guys, so many times when I say, here's the perspective that we're coming from, so many people say, that makes so much sense. I understand why maybe I haven't gotten better, or maybe some of the things that I've been doing just haven't been working. Because remember, we're always coming from a different perspective. And I always tell you guys, you can help solve a lot of your problems, or you can start heading in the right direction if you come from the perspective that the body doesn't make mistakes. The body doesn't mess up. It doesn't mess up. So you got to understand that so many times we think the body makes a mistake, or the body's attacking you, or the body's trying to go against you. And the body's never going to go against you. And in fact, it's always going to always try to help you, and it's going to adapt. And many times how we're actually adapting is producing symptoms, and we think the symptoms are the bad things, but the symptoms actually are our friends. So many times the symptoms are actually the cure. And so many times what we're doing is trying to suppress symptoms. And in fact, what we're really doing is we're trying to suppress the actual resolution of something. So I'm going to go over with you guys today a little bit different perspective on exercise. And I know in the past we've talked about like metabolic conditioning and the difference between that and you know the benefit over doing long drawn out cardio and things like that. But today I'm going to show you a different perspective when it comes to movement. And I know I had jumped on and said, hey, I'm going to talk about the 5. And I said, do you guys know the 5 movements? And a lot of you got maybe 1 or 2 correct, but no one who actually submitted their answer got all of them correct. And I said that I was going to do 5, but actually this morning when I came into the office, I said, you know what? There's actually one that I want to add. I'll tell you why. And so instead of doing 5, I X'd that out, and I'm going to go over 6 movements. So today, guys, I'm going to go over the 6 movements to master, to help you to look and to actually feel a lot younger, okay? So many times what we do, I was actually really guilty of this in the past, is because just what I learned, is just the perspective that I had learned, from reading a lot of muscular development magazine and reading a lot of men's health magazines. And basically what they told you is they told you to do some bodybuilding and then do, a bunch of cardio. So that's actually what I did. It actually helped me to build a lot of muscle, but it also helped me to build a lot of muscle that I couldn't use, okay? So what I'm going to show you is that if you can start to master these movements, you will move better, you will feel better, you will look younger, but you will also actually build a very athletic physique without having to do all of these strange movements and bodybuilding movements and things like that. So 6 movements that I want you to start to master to look and feel younger. What I mean by master is that for some of you, this may be an ongoing process of just trying to get better to get to just certain benchmarks. Many of these guys, you won't even be able to do. And so don't be frustrated. Don't give up. Just keep moving forward. That's one of the biggest problems that I see in working with people, is that if they aren't a master of something right away, then they just give up. And so some of these things I'm going to show you that I'm still trying to improve upon and starting to master. That's the beauty with actually learning a new skill, is that there's always going to be room for improvement. Figure out where you're at, then figure out a plan in order to progressively get better so that you are actually aging in reverse. So guys, these are things that are unbelievable and awesome to start to master, because really the great thing about it is that it's going to help you move more like you could when you were 15, 20, or 25 years of age. So these are things that I keep working on mastering, And here's the beauty of it. The beauty of it is this. I am 44 years of age, and I can move better, and I am stronger than I was when I was 24 years of age. So I have put 2 decades of age on my body, yet I'm actually stronger. And then what does society actually tell you? Society says your best life is going to be at 20, 25, and then around 30, things are going to start to take a turn for the worst. 40, even worse, and my goodness, after that, you can just see a progressive decline in how you move, how you feel, all of those things. That's what society actually tells us, and you know what we do? We listen to that, and then we start to act in accordance to what society, what doctors actually tell us, what the magazines tell us, what the health bloggers tell us, and the reality is all they're doing is parroting information that they learned from the previous generation. So one of the things that we do, we go against the grain, and we actually say in a lot of people, what is actually possible? And when you push the limits of possibilities, you get to realize that a lot of what we learn when it comes to health, when it comes to movement, is just a bunch of baloney, and a lot of it is just parroted because that's what we just learned in the past. So I'm going to go over these 6 movements, okay? But before I do that, I'm going to ask you guys a question, because many times I will tell people you need to start moving, and they say, oh, yeah, that just seems hard. I can't do it, or you don't understand. Dr. Nate, I'm 40, I'm 50, I'm 60, I'm 30, I'm too old. But I want to give you a really awesome perspective to help you guys start thinking a little bit differently, because I want to ask you guys a question. Which one of these cars are older? Okay, so here you have a Mustang on the top, and you have a Mustang on the bottom, okay? And both of those cars are both a 1969 Ford Mustang. Both of them are. Now, the one on the top, that is a nice looking car. Maybe one day I'll have that, but I haven't hit a midlife crisis yet to want a really fast sports car. But at the top is a 69 Mustang, and also at the bottom is also a 69 Mustang. So guys, I want you guys to understand is that both of those cars are the same exact age. They're the same exact age. The only difference between those 2 cars was their owner. Let me say that again. These cars are the same exact age, and the only difference was the person who took care of it. And that is 100% the same thing when it comes to our bodies, when it comes to our aging, when it comes to our ability to move, is that why is it? Is that 2 people who are 50 years of age, one can squat, the other one's getting a knee replacement. And it all comes down to the person who was taking care of their body. See, we really don't have much of an idea of really what is possible at 60, 70, 80, 90 years of age, because really we just have been taught that, start taking it easy. Start avoiding things at 30. Keep avoiding things because we're so afraid of things hurting. We're so afraid of getting injured. We're so afraid of being in pain. We're so afraid of being uncomfortable that one of the things that happens is we stop doing those things. We start moving towards comfort and safety. And you know what our reward is? Our reward is immobility, joint replacements, and feeling lousy and not having any energy. Versus the opposite of actually saying, I'm going to improve myself, I'm going to take care of myself, and the reward is high function, independence, feeling great, and also saving hundreds of thousands of dollars in medical bills, okay? So it comes down to the owner. You're the owner of your body, and my question to you is, how well are you actually taking care of it, okay? So here is a great quote, and this is not my quote. This is actually from a really awesome doctor. You guys should follow him. On Facebook or follow him on Instagram. It's Dr. Tommy John. Dr. Tommy John says this: young people should move, older people should move more, and injured people should move the most. And isn't that amazing, okay? Because we have younger people who are moving the most, older people who are moving less, and injured people are actually just immobilizing things or getting joint replacements and not moving at all. And you'll see, guys, what has happened obviously in our society. My goodness, look at the amount of joint replacements that are taking place in the United States. So young people need to move, older people need to move more, and injured people should move the most. Now, if you actually see, for some of you, that name actually may ring a bell because Dr. Tommy John is the son of Tommy John, the Major League pitcher, who actually was the first person to get the elbow reconstruction surgery called Tommy John surgery, in which they actually replaced what's known as the ulnar collateral ligament that gets so damaged with the pitching motion. But here's the thing, is that 2/3 of Tommy John surgeries right now that are taking place in the United States are actually, kids that are under 18 years of age. So the problem is that even when it comes to youth sports, is that we are teaching kids highly specific, sport-specific movements, yet they have no basic underlying athletic ability to be able to actually move correctly, and that are really geared towards any kind of athletic performance. And this is why we're teaching highly sport-specific things when they're not actually even trained or even geared towards even doing those specific things. And so I know that he talks a lot about most people are just so undermoved, and this is one of the reasons why we get injured when we're actually trying to celebrate, like playing golf or running or doing things like that. That stuff is not training. That is actually should be at the peak of our training. That is actually the celebration of our training. But I'm going to show you some foundational things that you guys obviously need to do first, okay? Now, a lot of these movements are going to be geared towards reversing things that actually are caused by inactivity, okay? A lot of these things are reversed by what are caused by inactivity. So really, guys, when we see so many people, this right here is by far and by far away the most common posture, we call it a postural distortion, that we see in people who are coming in and they say, Dr. Nate, I just need you to crack my back. Just crack my back and loosen some things up. But in reality, what you see is you see really bad things that are happening, and that things like pain and joint deterioration, neurological compromise, and things like that is the result. So there's so many people that are coming in, they say, I just want an oil change. In reality, what they really need is they need an engine overhaul. So this right here, when you see the granny posture, posture of head, posture going forward, head going forward, rounding of the back, the rib cage bows backwards, the hips are tucked underneath the pelvis. So even at the gym or even people coming into the office, if their posture is in that position, they are going to have a really hard time doing these 6 movements. It's probably going to hurt. They're not going to move very well. They're going to have lack of mobility. But the reality is, guys, is that even your posture, and what happens to the nerve system, these are some of the things that will happen when you are in this postural position. And the number one reason why we get into that position is because we sit for 8 hours every single day. If you are in this postural position, you will have a hard time doing these movements in order to stave off the aging process and to help improve your energy and to look and feel younger. And so many times I will tell people, because their goal is, I want to be able to get in shape, I want to be able to move better. And I'm like, okay, well, we can fix your labs, but you're going to get to the point where you can't move. And so you're going to have to actually start correcting the physical frame so that you can even get to a point to be able to exercise. So being in this nursing home posture, here's what it leads to. And this is actually well researched, well documented. Go into PubMed and look at hyperkyphosis and its relation to heart disease. Look at hypolordosis of the cervical neck, of the cervical curve, and see what that actually can cause from a neurological perspective. Because you're going to see that neurological issues will lead to organ issues. So the skinny of it is that you'll get poor energy, you'll have reduced lung volume, an inability to be able to take in enough oxygen, you're going to have poor gastrointestinal function, you're going to have reduced shoulder mobility, meaning if you're in this position, you won't be able to flex your arm up really past about 45 degrees above horizontal, but if you have good posture, you'll be able to go all the way up. To do things for everyday life, you will have disc degenerations, disc herniations. You're going to have an increase in pain. You're also going to have an inefficient gait. Have someone watch you walk And if you do this, if you're a clodhopper, when you walk, you have a very heavy gait. This is the posture that this is associated with, and really the reason why you have such a heavy gait is really because when you go into this position, you have so much atrophy of like the abdominal muscles, and you have atrophy of like the hip flexors, which are by far and away one of the most important muscles to actually train. But you'll also be able to have an inability to be able to squat or lift things from the ground. That sounds like things I need for everyday life. I'm going to need to be able to lift my shoulders up. I'm going to be able to need to squat to be able to get off the toilet. I'm going to need to pick some things off of the ground. And this actually is when people who say, Dr. Nate, I don't know what happened. I was just picking up a matchbox and my back went out. Guys, it wasn't the matchbox, right? It's actually this. So some of you to be able to do this are going to need actually some pretty extensive work in order to just start getting you back in this position so that you can in fact start doing these exercises to then get to the point to start looking and feeling younger. So guys, there's never just a simple fix. There's never just, you look at someone's lab and say, you know what? All you need is just a little bit more zinc, and then your life is going to be so much better. Man, I tell you what, you know how many people come in and they're taking 19 different supplements and none of them are actually helping them to feel better. And the reason why is they say, well, what test did you take in order to see if you actually needed it? And they're like, I don't know. Dr. Oz said it was good for you, so I started to take it. So remember, guys, these are very complex problems that you need to start from the ground up in order to restore and start to rebuild your body, okay? So let's go over these 6 movements. Let's go over these 6 movements, okay? Now, I know that a lot of you are going to say this. Yeah, but Dr. Nate, what about this? Or what about this? But I'm going to tell you that these are some foundational movements that then you actually can build similar type movements. But if you look at actually how the body works, one of them is the ability to be able to squat. And what you actually see here is someone performing what's just known as an air squat. So you'll see their ability to be able to squat down, keep their chest upright, and not actually round out their upper back or their lower back to get down into this position. A lot of times people say, well, Dr. Nate, I can't squat because my knees hurt. And I say, actually, the reason why your knees hurt is because you can't squat, or you don't know how to squat actually correctly. Guys, this is actually very nourishing to your hips and very, very nourishing to your knees. Guys, if you're moving correctly and you're actually moving it, it's one of the ways to actually nourish the joints. But if our knees hurt, we say, well, maybe I just need to not do anything. And guys, yeah, the acute inflammation will go away, but then what you'll see is you'll see atrophy of the muscles around it. You'll see stiffening of the actual connective tissue. And you'll actually see the cartilage, which needs to get nourished by movement, you'll see the cartilage actually start to wear away. So many times your problems aren't because you've been moving too much. It's actually because you haven't been moving enough correctly. So the first one is learn how to squat. So yes, there's all different types of things that you can do off of this movement, off of this squat, because you have the air squat. Then you might have the front squat. Then you might have the back squat. You might have the overhead squat. You might have basically a goblet squat. Or you might, so you guys see how many different squat variations you can actually do off of this. And they're all stimulating things have a little bit different stimulus that's going on. But guys, master the ability to be able to squat. And after 10 years, I still don't even have a perfect squat. However, if you look at how I squat now versus when I was 33 years of age, it is a night and day difference. Learn it and then make sure you keep doing it, because my plan is that to be able to have a near perfect squat at 54, at 64, and 74 or 84 years of age, because I want to be able to squat down. I want to be able to bend over. I want to be able to get off a toilet. I know my kids. If I cannot get off a toilet when I'm 84 years of age, they are going to want to put me in a nursing home. They're going to want my inheritance, all right? It's just how we work. So that's the squat. Learn how to squat. Now, I can't do this, Dr. Nate. Well, then learn something that's going to be learn a progression. This is why a lot of you need coaching. Learn a progression on how to get to the point to be able to get there. You're going to need a coach who's actually going to need to actually maybe correct your posture. You're going to need someone who's actually going to need you how to actually start doing some things with mobility to be able to like have the flexibility to get into that position. One thing you can actually start at with anybody is just learn what's known as a simple box squat. Well, Dr. Nate, how do you do a box squat? There's YouTube. There's millions of videos on YouTube, and I guarantee if you type in box squat, you'll be able to see what a box squat actually is. So it's just basically the most beginner form of actually learning how to actually squat. Everyone, in my opinion, needs to learn how to squat. Now, why is this also a great movement? Because it involves so many different muscles. It actually involves the glutes, it involves the hamstrings, it involves the quads, it involves the feet, it involves actually the lower part of the back. So you guys are going to note that doing movements that require multiple different joints and multiple different muscles are actually the ones that are going to be building the most amount of muscle. You're not going to be building a whole lot of muscle by doing a bicep curl, okay? These things, when you're doing them, you'll notice they'll actually make you breathe hard. They require a lot of muscle contraction, and they also will get an amazing hormonal response of growth hormone, testosterone, and things like that. Because when you do that, you're involving multiple different muscles, okay? Now here's the next movement. First one was a squat. Next one is called the deadlift, okay? This is called the deadlift. So what is this? This is simply picking something up from the ground and then picking it up to hip level. It's a deadlift. It actually looks pretty easy, but one of the things I've actually found is that there are so many people who don't know how to correctly pick something up off of the ground. Now, you probably have heard it before when people say, lift with your legs and not your lower back. Guys, to pick something off the ground, you shouldn't be squatting down. You shouldn't be going into a squat and lifting it up. That is not the proper way to deadlift. You should actually be picking stuff off of the ground, actually using your lower back, and also using your butt, and also using your hamstrings. Those are some of the most powerful muscles in the body. The butt and your back, everything on the back of your body are some of the most powerful muscles. And if they're not, then you're going to have a big time problem. So you're going to notice is that picking things up, people say, well, I don't want to pick things up because I'm afraid I'm going to hurt my back. Guys, if you do it correctly, you will not hurt your back, but you have to learn how to actually do it correctly. And so you'll notice that what this person is doing is that it's called a hip hinge. So too many of you don't know how to actually brace your lower back and hinge your hips. And this is a great movement to actually learn it. Picking stuff up off the ground. Now, this guy's actually using a barbell, but can you use a kettlebell? Yes, you can use a kettlebell. Can you use a barbell? Yes. Can you use a sandbag? Yes. So you guys understand that there's so many different variations that you can do off of the deadlift. And in fact, anything that causes you to hinge your hips is going to be a great movement for you, which also would be a kettlebell swing, which is really similar to a deadlift. So I remember, 33 years of age, I had a terrible disc herniation when I was about 22. I went through a whole entire year of literally moving from sitting, standing, and then laying on my stomach about every 2 minutes for a whole entire year because I was just in unbelievable, unrelenting pain. And I know, guys out there, it sucks. Oh my goodness. In fact, I talked to a person today where it's just so much unrelenting pain due to a disc herniation. And these people, if you've ever experienced it, it is extremely painful. It might not be as painful as giving birth or as painful as having a kidney stone, but just remember, a kidney stone eventually goes away. Birth happens, can happen relatively quickly. But some of these people who are having pain from a disc herniation, they have been in pain for a whole entire year, and it will absolutely destroy their hormones. It will destroy their energy levels. It will destroy their stress hormones. It destroys obviously so much being in so much chronic pain. So I was just like, I'm not going to pick anything up off the ground because again, I had bad advice, from a lot of people. And so at 33 years of age, I was like, I didn't know how to deadlift, and picking up 95 pounds off of the ground was actually not only scary, but just downright difficult. And so I got to the point where I said, well, I need to learn how to do this correctly, and I need my lower back, my butt, my hamstrings to be really, really strong. And so I just started at 95 pounds, and I have made it up to, just about 2 weeks ago, 420 pounds for a set of 3, okay? Now, that's probably not gonna set any kind of world records, but it's a heck of a lot better than what most people can do, and it's not doing too bad for someone who is 44 years of age. So you guys have to learn how to deadlift, because how many times do you need to squat down? How many times do you need to pick stuff up off the ground, and to do it well and to do it with perfect form? This is another exercise that is unbelievable as far as putting on muscle mass. Guys, look at people who are like professional, like power lifters or deadlifters. They have an unbelievable amount of muscle mass, and they don't do any kind of bodybuilding. So doing squatting and doing deadlifting is actually something that will put on muscle mass globally all over the body, okay? Here's the next one. The next one is called the press, or the shoulder press. So this is basically taking any kind of weight, and it doesn't have to be a barbell. It can be a kettlebell, it can be a dumbbell, it can be a sandbag, it can be anything, and going from this position and then going actually overhead. So this is just called the press. Now, are there other variations of it? Yep, you got a strict press, you got a push press, you got a push jerk, you got a split jerk. Basically, it's using either strict by, not quote unquote cheating, or using your body weight to propel it up, or using your body weight to propel it up and then drop underneath it. So the press is unbelievable, because how many times in our everyday life do we need to pick something up, and then do we need to pick it up and over our head? So doing the strict press is unbelievable in doing this. Now watch, if you have a granny posture, if you have problems with shoulder mobility, you're going to have a hard time actually pressing something up, and it probably will hurt. You probably, if you have done anything overhead and you're experiencing things like pain in the front of my shoulder, like bicipital tendonitis, or you do this and you get like a pinching sensation and you get a pain like right on the deltoid, that's called bursitis. When people say, well, I hurt my rotator cuff is torn. Guys, chances are if you have a torn rotator cuff, this is actually because your head's sticking in front of your body, your shoulders round and forward, and it's just causing deterioration of the rotator cuff tendon, okay? So learning how to press and learning how to press correctly is a vital movement, Now guys, when you do this too, you know what's really cool about this? Because some of you are going to say when I go over these movements, because I've gone over 3 so far, you're going to say, well, what about all this abdominal work? Guys, the purpose of your abs is not for you to be able to do a sit-up. The purpose of your abs is actually to stabilize your lower spine. So do you think when you press something over your head, do you think you're using your abs? Absolutely. Are you using your abs when you're doing deadlifting, and are you using your abs when you do a squat? You're using your abs all the time. So this is why these are great full body movements. Here's the fourth one. The fourth one is any kind of pulling movement using your body towards you, or pulling yourself up in a vertical position. So this can be a pull-up, but this can also be, which is going to be a little bit easier version, known as the ring row or an inverted row. So can you use rings? Yes, I prefer rings because they're not as stable. Can you use a bar? Yes, you can actually use a bar. But basically what this is keeping your body rigid, using the rings and putting yourself in about a 45-degree angle and pulling the rings to actually your chest. So what does that actually work? This works in some of the weakest muscles in your body, which is going to be the muscles in between your shoulder blade and a lot of the stabilizing muscles around your scapula, your shoulder blade. But this is mostly working on your upper back. So we have so many people who come in, their shoulders are just rounded forward and they can't lift them up and they can't pull back into this position. And we'll actually do a very specific protocol called crossover symmetry, which actually helps to reconnect the brain to those throwing muscles and to those upper back muscles. And it's just using really light tubing. And these people are like, oh my gosh, that was so hard. But one thing that you can do, and you don't have to invest in a whole entire system, is go on Amazon, get some rings that are about 35 bucks, some wooden rings, 35 bucks, and you can attach them to a doorway. You can attach it to a tree limb. It doesn't have, you can, anywhere you can attach it to, and just work on doing that and pulling yourself up. Now, something that's going to be maybe a little bit more harder is being able to do a strict pull-up. So being able to pull yourself up into that position. So there's so many different modifications that you can do. An easy thing is, well, I can't get down in that position and pull myself up. Well, just walk your feet up so that you're a little bit more upright, and you'll notice that'll be a little bit easier. So you're going to see this is a multi-joint movement that is really good for the upper back. It's really good for the shoulders, really good for the biceps. It's really good for your grip strength as well. That's one thing that's really bad in people, that like even deadlifting and even doing this is going to help, is actually grip strength. So, I think that people should be able to hang themselves from a bar, in that position, and do it at least for 1 to 2 minutes to be able to hold on to their body weight for that long. Because guys, when we're just typing all the time and doing that, we just don't carry things for as long as we're actually supposed to, okay? So you actually want to build tremendous traps like these muscles in through here, then get a couple of kettlebells and just carry them while you walk, because it makes you have to contract your traps in order to be able to carry that weight. So this is why I always shake my head and I look at people who are going into the gym and they're doing these shrugs and things like that. I'm like, just carry some heavy dumbbells and you'll actually accomplish the same purpose. All right. So here's the fifth one right here. The fifth one is the least favorite workout or workout movement ever. Everyone hates these, including me. I don't like them as well. But this right here, this is called the burpee. All right. So this is the burpee, most dreaded movement. Okay. Now, why do I actually love the burpee? Well, because all the burpee is going from a standing position, going down to the ground, the chest touches the ground, and then popping yourself back up and then standing up, okay? Now, there's a lot of different variations. So the one that I normally do is just pop down the ground, chest touches, and then pop yourself back up. That is very taxing on the body. It's also a great way to work on conditioning, because basically you have to push your body weight up every single time. And if you don't believe me, then take 1 minute and try to do as many burpees as possible in 1 minute, and I guarantee you, you will be breathing very heavy when you actually do just 1 minute of burpees. Now, there's a lot of variations that you can do. People are like, well, I got bad knees or I don't have very good balance. Well, then just crawl yourself down to the ground and then crawl yourself back up. Do it in any way. If you need to hang on to something, hang on to something. Get a box, get a coffee table, and hang on to it and push yourself up. But then just keep moving forward from that. So the burpee, why do I want people to be able to do it? Well, do you know how many people that I asked and I said, hey, if you were to fall on the ground, could you get back up? And you know how many people say, if I didn't have something to hang on to, then no, I wouldn't. And I'm like, so you mean to tell me that if you fall, you're by yourself, you can't get up? You are just going to stay there and die, or hope somebody comes within the next 2 or 3 hours. So the burpee is unbelievable. In fact, I actually told a woman, she has suffered with type 2 diabetes. The numbers are all getting better. She's lost about 35, 40 pounds, doesn't have all the chronic pain in her joints. She was also having tremendous gastrointestinal pain as well. Part of it was actually just because of the actual diabetes medication that causes so much abdominal pain. But she said, I can't, now that I'm feeling so much better, how do I get myself to be able to move better? Because I'm 76 years of age, and I don't want to go to the nursing home with all of this newfound health, but I'm not able to move my body. I don't want to be a prisoner in my body. And I said, well, start off by doing 1 minute of burpees, 1 minute of rest, do that for 3 rounds. And then, in 6 weeks, let me know how many burpees you've gone up to over those 3 different minutes, okay? Now, is it painful to do this? Yes. Will you breathe hard? Yes. But guys, we are just so in love with comfort and safety, and we are scared to death of risk and reward. The only way to move forward in life is to actually shun comfort and safety and always be going towards risk and reward. So yes, doing this is very painful. It's painful. But do painful things, do hard things every day, and those hard things become easier. And then you just move on to the next harder thing. And here's the sixth one. The sixth movement that I think everyone should be able to master. And it's this. It is jumping rope. It's jumping rope. Well, Dr. Nate, I listened to this whole thing and I could have swore that you were going to say jogging or the elliptical or the bike or a rowing machine, but you didn't say any of that. Do you mean that that's not important? No, those are great. Those are awesome. However, if you're going to train yourself, running only makes you a good runner. Okay? That's really all that it does. Yes, it can improve the cardiovascular system, but I'm always like this. If you're going to do something that's going to improve the cardiovascular system, yes, elliptical will do it. Yes, a treadmill can do it. Yes, some of these weird contraptions can actually do it. But do something that's going to make you better in your everyday life. And why is jump rope, why is that actually so important? Is because jumping rope is very metabolically taxing, extremely. And in fact, if I said, I want you to try to jump rope continuously for 3 minutes, most people will be breathing very heavy. Most people, their feet will be on fire, and most people, their shoulders will be on fire as well. So this is actually really a good movement that involves the shoulders. It involves the metabolic systems, and it also, the reason why I like it so much is that it involves some of the weakest parts of our body, which is actually the feet and the ankles and the calves, okay? Feet and the ankles and the calves. So there are so many people, especially as you get older, where where your feet are so weak and so atrophied because you really haven't done anything to stress them at all. I want you to think about it. For a lot of you, the most taxing thing you've ever done on your feet is just walking. And if that's not enough, you go and throw on some hyper cushioned soles that then feel all squishy, that don't actually demand any kind of contraction or any kind of response from the muscles within the foot. So then what happens is that you may start running and start to increase the impact, and then you guys will start to have plantar fasciitis, start to have pain in the foot, you start to have ankle issues, shin splints, you start to have Achilles tendonitis. And you wonder, you're like, well, maybe I shouldn't do that anymore. But the reality is that your feet are just so immobile, they've become so atrophied that doing anything that's even remotely harder than walking is that you're not able to do it. So this is why I absolutely love jump rope, because it's that bounding motion that actually will start to strengthen the feet, strengthen the Achilles, and it's great for coordination, and it's also great for balance. Now, I remember, I'm a little bit of a nut. When I was about 13 years of age, I remember I went to my dad, and I said, Dad, I want to be a better jumper, all right? I want to be a better jumper. I want to be able to dunk. I want to be able to do those things. And I said, Dad, what should I do? He said, well, what I did is I jumped rope. And I was like, okay, so is it like 10 jump ropes? Is that what I need to do, or 15? He said, well, the most I ever did in a row without stopping and without messing up was about 1,500. So he could jump rope 1,500 reps without stopping and without messing up. So I remember the first time that I did it, I think I did 13 in a row, and my feet hurt, my calves hurt, all those things hurt. But I was just really deconditioned, and I just kept doing it. And so within about 6 months, I went from 13 in a row, and I got up to 1,600. So I was able to jump rope 1,600 reps in a row. But you will develop very strong feet, very strong ankles, and very strong calves. And so this is why I love the jump rope. So if you can't jump rope, well then just start bounding. Even if you're just going up onto your toes for 3, 4, 5 minutes and start working from that. If you don't have the coordination to be able to jump rope, then just start jumping up and down. Start doing that. Then add in a jump rope and just start and do singles. Try to go as long as you can. And then finally, if you get really good, you can move into doing things like double unders or even triple unders and things like that. So all of these different things, guys, are going to have an amazing benefit. Now, are there other movements that are good and beneficial? Absolutely, absolutely. But this would be a great start somewhere approach, whether you're 20, 30, 40, 50, 60, 70 years of age. And I'm going to tell you something. The worst thing you can do is tell yourself that you're too old. Tell yourself that you're too run down, that you're too decrepit, because if you tell yourself that every single day, you will actually do exactly what your mind is telling you, and the only way moving forward is just going to be to get worse and to go downhill. I want to give you guys a couple of some inspirational tips, okay? Some inspirational moments. So this is actually some people from our gym, and let me back that up and I'll give you a little bit of a background regarding this. So these are actually people at our gym. We have people who are 15 years of age that work out. We have people as old as 75 years of age that work out, and they don't do the same things, okay? They don't do the same things on how they look, but they all do the same things, but just different variations of it. So here's a woman who's 70 years of age. So here's a 70-year-old who is deadlifting, okay? Here's a 72-year-old who is deadlifting, and by the way, that's about 250 pounds, who started off at about 75 pounds, okay? And here's someone who's in their 50s, who again is learning how to deadlift. And you can see that they're actually doing it properly, all right? So look at that. So they're doing the things to stave off illness, stave off injury, and improve their function. And these are people that are all over into their 50s, 60s, and even into their 70s years of age. And we have had people in their 60s who have been able to climb a rope 15 feet into the air like you used to do in gym class. And what is that? That is actually just basically your ability to do a ring row and be able to pull your body weight up and then secure yourself with the feet, okay? So watch. For a lot of you, you're going to say, I can't do that. I can't do it. I can't. There's no way that I can do it. But maybe for some of you, you just have to learn how to crawl before you walk. So maybe you might need to say, I need to just do some foundational things first, even before I can even start picking things up off the ground. So look at a baby. In order for a baby to be able to walk, what they first have to do is they have to be able to develop the strength and the coordination to be able to put one foot in front of the other. That actually requires the actual learning of crawling, or getting onto the hands and the knees, and to crawl for 3 or 4 months before they have finally developed the stability and the strength to be able to walk. And just think of this, guys. If you had kids, you never went to your kid and you never said, you know what, Johnny, I don't know if this whole walking thing is going to be for you. Because maybe you should just stick to crawling for the rest of your life. It's just taken a little bit too long. So if your child is trying to get up into a walking position, they fall down, you don't tell them, you know what, maybe you should just crawl for the rest of your life. You know what you say? You say, keep going. You have a child who's learning how to ride a bike and they fall down the first time. You didn't tell them, maybe we should keep the training wheels on. I don't think riding a bike is cut out for you. No, you know that if they don't quit and they keep going, they're going to finally learn how to ride a bike. It doesn't matter how long it's going to take. You know that you just told them, just don't give up. But how many times in your life when you tell your kids not to give up, that you actually do something and you give up right away? And your kids look at that and say, hey, you're not preaching, you're not living what you're actually preaching. So you may need to crawl before you walk, and this is why coaching is so absolutely needed. Here's someone who's learning how to crawl before they walk, figuratively speaking. So this woman right here had a lot of problems, had a lot of issues. And so you know how we're starting her off first? We're just starting her off just doing a little bit of step-ups and actually taking about 6 pounds and learning how to go over her head. She's actually learning how to do a jumping jack. And one of the reasons why was because just of years of inactivity and years of abuse. And the reality is what's so great about her is just she says, I know I'm bad, but I'm willing to actually start somewhere. So I guarantee it, she's going to continue to get better. She's going to continue to move forward, and she'll move ahead her friends who say, you know what, it's time to stop moving. It's time to start enjoying the walker. It's time to start enjoying the cane. It's time to just, give yourself all of these different aids and supports, because I guarantee it, as soon as you choose the cane, as soon as you choose the walker, it's going to be downhill from there, and it will happen very quickly, okay? So here's my quote: stop acting your age. Stop acting your age, okay? Society tells us that you need to act a certain way when you're 50. You need to act a certain way when you're 60. Don't do things when you're 70. Testosterone's supposed to tank when you're 60 years of age. That you're supposed to have menstrual issues at this age. Stop acting your age, because the people who tell you this is how it's supposed to be have never done anything to go against the grain. And in fact, some people will tell me too that, wow, you maybe should act more like a doctor. And I'm like, you mean the stuffy doctor who hasn't inspired you one bit to change anything about your life, but just put you on a bunch of medications hoping you'll just go away? So people say you need to act a certain way. People need to say you need to exercise a certain way according to what your age is. And guys, age is a number. Remember that car that I showed you at the very beginning. It all depends on who the owner is. And so it's up to you to make sure that you, as being the owner, are taking meticulous care of your body. You have one body to live in to carry out your great purpose in this life. And why do we treat it like a bag of garbage? We need to start treating our bodies the same way, and we need to be spending time every single day taking care of our body and taking care of our human frame. So stop acting your age. And I know every single week we get people who say, well, how do I do this? How do I train? Where do I start? Well, I would say you need to find a gym. In your area. I would actually start off by finding a gym that has the word CrossFit on it, because they will know, no matter how old you are, how to take you through the right progressions. But I know at our gym, we work with people when it comes to 15 years of age. Actually, I'm sorry. We actually work with as kids as young as 8 to 9 years of age. And you know what we're working on? We're working on all of the movements that an 8-year-old doesn't remember how to do that they knew innately when they were 2 or 3 years of age, because we just stopped training it. So 8, 9 years of age, all the way up to 75 years of age, but everyone is different. That's why we have different programs for people, whether it's CrossFit or whether it's Burn or whether it's the kids or whether it's Legends, people over 55 years of age, because the training is going to look a little bit different depending on what their restrictions and what their mobility is. And so that was one of our passions that we said, for me being a doctor, I said, I don't have anywhere to actually send my patients to. And for a lot of them, we will actually send them to the gym with a free month membership. And I say, listen, start doing this. You'll learn some stuff. If it's not a good fit for you, but it's a good fit for everyone, then at least you'll learn some stuff. But I guarantee you, if you'll see that you'll start getting better, and that this is something that you will want to continue for a very long time. And it's something that I have continued for over 10 years, almost 11 years. And then people actually say, wow, I can't believe how much younger I actually feel when I start moving my body. So if you've made it to this far and you are in the Yorkville area, please message me. Please message me. We have a gift for you. All right? So please message me. We have a gift for you. And that gift is actually a membership for 1 month to our gym, because I want you just to be able to experience it, okay? To experience truly what it feels like to start working on something that's going to make you tremendously better. Now, coming up this Tuesday, if you're from the Yorkville area, is the inflammation talk. Spaces are filling up for it, but I had a conversation with a guy, actually even today. He's my age and extremely low testosterone, like at 200. He's like, Dr. Nate, I'm fatigued all the time. I have no energy. And there's just other issues going on that are associated with having testosterone of 200. And so the first thing I said is, well, it's not with your anatomy. You know what I'm talking about, both of those. The problem is that first and foremost, that there's inflammation and there's actually infection that's actually going on. And he said, well, aren't you going to do anything for my testosterone? No, you have to handle the infection first, because when you are inflamed, guess what it actually will affect? It'll affect things like weight loss. It'll affect things like cancer. It'll affect your hormones with infertility and thyroid issues, arthritis, type 2 diabetes. problems with hormone imbalance, autoimmune conditions, all of those things, guys. If you understand, man, if you want to feel better, start to know how to actually handle inflammation from a chemical, a mental, and from a physical perspective. So guys, if you're from the Yorkville area, just go to the top of this page. We have pinned our actual inflammation event where you can actually register for it on an Eventbrite page. It's free to attend. We actually give you a gift at that event too. That's worth about $45 or $50. And guys, this event will help you to see things from such a different perspective on how we actually get such great clinical results. So guys, hopefully you learned a lot about those. If I went a little bit too fast, go back and learn it again. Get out YouTube and start looking on how to do those things. Get to a gym in your area. Start working on those things. My goodness, for some of you, get to a chiropractor who knows what they're doing. But next week, guys, this is going to be over 4th of July weekend. I still will go live. And I'm going to talk about this right here. Oh my goodness. Why testosterone replacement therapy is a really bad idea. Why it's a really bad idea. And that is my opinion, but I'm going to show you actually through research why it is. But clinically, why, guys, if a guy has low testosterone, by putting on a cream or injectables or pellets in their, why that can be a really bad idea. And I'm going to show you on a lab why that can be such a bad idea. But I listen, I learned so many different things. There is so many of these clinics that are popping up about taking hormone replacement therapy, testosterone replacement therapy. Heck, people in the health realm that are talking about how awesome testosterone replacement therapy is. And it can lead you down a very bad path. And there's so many people who tout it who have no idea how physiology actually works. Just because you can feel better, in 2 months taking some testosterone doesn't mean necessarily that you should do it, because there are certain things that will cause issues with liver, conversion, other hormones that are going to be created as a result. And this is why I really believe that if you don't have your ducks lined up, testosterone replacement therapy is going to be a really terrible idea, and why you don't need it as long as you have 2 testicles. All right, and we're going to show you the difference on what you need to do instead, and it really actually comes down to lifestyle and making sure that a couple of organs are doing really good. Okay, so get your man on the next week's talk. He's going to want to see this, because I guarantee you your man probably has looked up the idea of testosterone replacement therapy, but there's actually a much better way, a better way that'll give better results, and a better way that actually will make you healthier in the process. So we'll be doing that next Saturday at 10:30 on July 3rd. Make sure you guys join us for that. And if you join us today, thank you very much. We always appreciate it. We appreciate all of you. And make sure that you share this. Share this with someone who says that they're too old or who's feeling old. Give them hope. Help them to see that there is a better way. And as far as what we're doing in our office, we are challenging the status quo. And when you challenge the status quo, there's going to be people who are going to disagree. There's going to be people who are going to fight you. There are people who are going to attack you, and that's okay, because I would rather be right and attacked than to be liked and to be wrong. So guys, have a great Saturday. Enjoy your weekend, and we'll see you guys next week. All right, be well.